Now, in recent years, it's not much of a stretch to say that someone you know has been diagnosed with dementia, in particular, Alzheimer's disease, the most common type of dementia. It's a neurodegenerative disease that usually starts slowly and progressively worsens, a disease that literally causes the brain to shrink and brain cells to eventually die. Now, for those living with Alzheimer's disease, daily life could be a struggle, memory loss, not pleasant for anybody. But what if I can tell you there's a company out there, a publicly listed company that's developing the first natural cannabis-based investigational drug being tested in human FDA trials to treat Alzheimer's patients. Yes, low doses of cannabis, and that's where IGC Pharma comes into play, a biopharmaceutical company that develops cannabinoid-based formulations for treating diseases and conditions including Alzheimer's disease. Recently, I was able to meet and interview both Mr. Ram Mukunda, CEO of IGC Pharma, and Claudia Grimaldi, CFO of IGC Pharma, who can tell us more about the company and its latest updates.
We are currently in a phase 2B trial on Alzheimer's. So we have a molecule that we are testing, and we're testing it to cure or to essentially address the neuropsychiatric symptoms that are associated with Alzheimer's. Actually, the brainchild is the University of South Florida did a lot of research using very low doses of THC on Alzheimer's cell lines and also Alzheimer's mouse models. And what they discovered is that these very low doses of THC, and you know what THC is, it's the psychoactive cannabinoid in cannabis. The low doses of THC combined with other molecules reduced the plaque buildup in cell lines. Essentially, plaques and tangles are the two hallmarks of Alzheimer's. And so we took all of that research. They spent many years, like 7-8 years doing this research. We took all of that and we created a formulation which we took to the FDA and ran a phase 1 safety and tolerability trial on that. And we found our medication to be very safe and also tolerable at 3 different doses.
Now, it can't be ignored that the idea of using THC has its detractors. Some will be for it, but some will openly dismiss it as being a treatment. To discuss the effectiveness and feedback of its IGC 81 natural cannabis-based investigational drug, here's more from the CEO and the CFO of IGC Pharma.
No, I think you're absolutely right. I think you bring up an excellent point, and many people bring up this point. Smoking weed is not what we're about. We are talking about ultra low doses of THC combined with other molecules that has been shown to be safe, tolerable, and has reduced and shown to be something that reduces symptoms associated with Alzheimer's, and also it reduces plaque and tangles, which are 2 hallmarks of Alzheimer's. So your point is very well taken. If we're not a cannabis company, we're not out there advocating that individuals who are 80 years old should be smoking weed. That's not what this is about. The other thing is that THC is biphasic, meaning at high doses, it does all the things that you said. It makes you high, lots of side effects. At ultra low doses, it does the opposite. It actually it enhances mitochondrial output, which is mitochondria is the energy pack of a cell. And it also reduces anxiety, reduces agitation, reduces depression. So this is a molecule that has very complex, and it does 2 different things at dose, depending on the doses. So it is THC is, as you know, it's an illegal. It's on the list of illegal drugs. Yeah, it's a scheduled drug. It's a Schedule 1 drug. But the Obama bill, what it did was to make hemp legal. And when hemp became legal, our medication actually has the legal limit of THC. So it's got 0.3% THC. So it's legal because it comes from hemp.
But you have to explain this to everybody.
Absolutely. We have a facility on the West Coast where we can extract. We actually grew the hemp in Arizona. We grew the hemp in Arizona. We took the hemp, we extracted from it, and we were able to isolate the THC that we need for the trials. And so we have to record, for example, we have to show, what type of strain was used, what type of, where it was, what licenses we used to actually grow the hemp. So it's a very, very legally laborious process. So the name of the drug right now, it's not a commercial name. It's called IGC AD1. And that's the drug that's in trials right now. So we're in a phase 2 trial. The trial's already started. We have about 4 centers up and running. We're looking for 13 centers. We're negotiating with another 20 trial sites.
But we have started in Canada and the US.
It's a US-Canada based trial, and we're hoping to, by the end of the year, we're hoping to get the trial done by January, February at the latest.
So now that we know where the product currently stands, it's the natural question to ask, what does the future hold for IGC Pharma and its IGC AD1 investigational drug?
Sure. Our hopes for the brand is, first of all, we want to address Alzheimer's in a lot of patients. We want the drug to be affordable. So first we have to make it a drug, right? But we want it to be affordable and accessible to everybody with Alzheimer's. That's our hope for the brand.
Yeah, we're trying to get it, actually we're trying to price the drug at $100 to $200 a month. So affordable, we want to make it accessible, and that's part of the mission of the company.